Hello all of you. Today AIDS Awareness Week is being celebrated in the Department of Microbiology of Pratap College Amalner, which is celebrated every year from 1st December to 7th December. We all are well known about AIDS. So here to aware all of us about AIDS. So I request you to join with us in the following event.
In 1980, April 24, San Francisco resident Ken Harney died and is reported to Center for Disease Control with Kaposis sarcoma. Many times we all have got into this question that where did AIDS come from? Scientists have traced the origin of HIV back to chimpanzees and simian immunodeficiency virus, means SIV, and HIV like virus that attacks the immune system of monkey and apes. In 1999, researchers identified a strain of chimpanzees SIV called SIV-CPZ, which was nearly identical to the HIV.
How HIV/AIDS spread? As we all know, AIDS is a contagious disease. There are various methods through which it can spread by blood products like blood, serum, vaginal fluids, rectal fluids from mother to baby by pregnancy or labor, or by having unprotected vaginal or anal or oral fluid.
There are several symptoms of HIV. Not everyone will have the same symptoms. It depends on person and what stage of disease. Symptoms of AIDS can include rapid weight loss, diarrhea that lasts for more than a week, pneumonia, red, brown, pink blotches on or under the skin or the mouth, noise or eyelids, depression and other neurological disorders.
If you have been exposed to HIV, your immune system will make antibodies to try to destroy the virus. Doctors use tests to find these HIV antibodies or antigens in your urine, saliva or bloods. The primary test for diagnosing HIV and AIDS are ELISA test. ELISA link immunosorbent assay is used to detect HIV infections. ELISA is quite sensitive in chronic HIV infections, but because antibodies are not produced immediately upon infections, you may test negative during a window of a few weeks to a few months after being infected. If ELISA is positive, the Western blot test is usually administered to confirm the diagnosis. Viral blood load test. This test measures the amount of HIV in your blood. It's used to monitor the treatment progress or detect early infections.
How we can prevent AIDS? Use a protection every time you have a physical relationship. Limit the number of your sexual partners. Avoid blood-to-blood contact. Avoid contact of vaginal fluid. Avoid contact of semen. Never share needles, syringe or other drug injection equipment. Use sterile needles, syringe or other drug injection equipment. Test yourself regularly for HIV. You can ask your doctor about pre-exposure prophylaxis and post-exposure prophylaxis.
Is HIV curable? No, HIV is treatable but not curable. But there is a drug called antiretroviral drug which suppress the virus and improve immune status. However, the patient remains HIV positive throughout their life and transmit the disease to others. So what is ART? ART is a antiretroviral drugs, which is a combination of 3 types of drugs and 3 different types of groups. It works to control HIV replication in the body and prevent the destruction of CD4 cells. Hence, it delays the progression and reduces the hospitalization, reduces transmission of HIV. ART increases the survival and quality of life. It is a lifelong therapy, requires high adherence, similar to treatment taken for high BP and diabetes patients.
First, International AIDS Society, founded in 1988. The International AIDS Society is the world's largest association of HIV professionals with members from more than 170 countries. Second, World Health Organization (WHO) is United Nations agency that connects nation, partners and peoples to promote health. Third, United Nations AIDS programs.